Deputy Pringle.
Yeah, Minister, I think people in Donegal don't want to see much more exploration of solutions. They want to see actual solutions taking place, and that's the actual problem. And I mean, the cross-border idea, I think I would have been very much in favour of the radiology that's been rolled out in Altnagelvin, but the elephant in the room in terms of that is in relation to Brexit and how that will impact on actually marrying those clinical services together and providing a service, if that's the way that's be done. But what we need to see is action taking place, and I think it will be a shock to people in Donegal to realise that a full-time locum breast surgeon is all that's been looked for at the moment, when in 2014 or January 2016 the announcement was that a full-time breast surgeon would be appointed to Letterkeny. So we have locums, we have enough of locums, we don't need locums, we need actual appointments and we need action. And I'll repeat it again, I would ask that you would take it up with the CELTA group, is that I would be very concerned that there is, and this was the thing that when the hospital groups were established that we were concerned about, is would we see a pull of services into Galway, and that certainly seems to be what's happening. And, you know, it's 4 or 5 hours journey time from Donegal to Galway to see services. If you ask somebody from Dublin to travel to Kerry to see a consultant, they certainly wouldn't stand for it, and I don't think anybody in Dublin would stand for it. And I think that's not fair to expect the North West the same.
I will certainly raise, Deputy, those points with the CELTA group and will revert to you directly on them. But I do think you make a fair point in relation to patients travelling to Galway when, as you know, as part of the agreement in terms of establishing this satellite unit, it's not just meant to be patients travelling to Galway, it's meant to be consultants travelling to Letterkeny. This is a point that I've taken up with the CELTA Hospital Group and with the National Cancer Control Programme when it was brought to my attention by the cancer support groups and by Oireachtas members in Donegal. It's absolutely essential that CELTA continue to manage the satellite service at Letterkeny University Hospital and ensure that consultants from Galway travel to Letterkeny. For one consultant to travel to Letterkeny to see patients rather than a number of patients having to travel to Galway, that was the concept behind having the satellite unit, that for certain issues the patient could remain in Letterkeny and the doctor could go to see them. For other issues the patient would obviously need to go to Galway, and I think that debate has been long had. So I'm continuing to take that up. I do think we need to see a greater direction of travel in terms of consultants travelling to Letterkeny, and I think there has been some concern expressed by groups in relation to that, so I'll revert to the Deputy further on the issues.